Hello and welcome to this 7-minute guide to the Multi-Agency Risk Management MARM Framework. Trafford Strategic Safeguarding Partnership have produced shared multi-agency guidance on managing cases related to adults where there is a high level of risk, but the circumstances may sit outside the statutory adult safeguarding framework, but for which a multi-agency approach would be beneficial. The MARM framework has been developed in response to learning arising from safeguarding adult reviews and seeks to enable a multi-agency approach which helps to identify and respond to risk before the crisis point has been reached. Our MARM framework enables a coordinated and collaborative multi-agency response to risk, ensuring timely information sharing, holistic assessment of risk, and development of multi-agency risk plans. The guidance is based on a number of key principles, including the duty to protect from foreseeable harm, even when the adult has the mental capacity to make the decision to not engage in care and support. The MARM takes a relationship-based approach, focusing on building trust and rapport in order to reduce the risk of harm, which may arise in complex cases involving people with long-term and entrenched behaviours. The MARM framework does not replace single-agency risk management arrangements and instead seeks to build on and complement these by providing a multi-agency dimension. Professionals must also refer to relevant statutory frameworks and operational policies which they are required to follow. So when is an adult considered at risk? An adult is considered to be at risk when they are unable or unwilling to provide adequate care for themselves and are unable to obtain necessary care to meet their needs, are unable to make reasonable or informed decisions because of the state of their mental health, or because they have a learning disability, or because they have an acquired brain injury, are unable to protect themselves adequately against potential exploitation or abuse, and have refused essential services without which their health and safety needs cannot be met, but have a lack of insight to recognise this. Who will use the MARM framework? The framework is likely to be useful to any professional who is working with adults experiencing an unmanageable level of risk as a result of circumstances which create the risk of harm but not relating to abuse or neglect by a third party, such as self-neglect, hoarding, fire safety, refusal or disengagement from care and support services when the adult has the mental capacity to make decisions about their care and support. Complex or diverse needs which either fall between or span a number of agencies' statutory responsibilities or eligibility criteria. Ongoing needs or behaviour leading to lifestyle choices, placing the adult and/or others at significant risk. Complex needs and behaviours leading the adult to cause harm to others. A toxic trio of domestic violence, mental health and substance misuse. Risks previously addressed via a Section 42 inquiry, but for which the need for ongoing risk management and monitoring has been identified. No one agency owns the process. Any agency can initiate the process. However, in doing so, the agency assumes the lead coordinating role with responsibility for convening and chairing the initial meeting. The purpose of a MARM meeting is to gain a holistic overview of current risks and to agree a multi-agency risk management plan. As far as possible, the adult should be included and involved in the process and in developing the risk management plan. If the collaborative assessment highlights circumstances which are more appropriately dealt with elsewhere, a referral should be made. The process continues until the identified risks are either resolved or managed to an acceptable level. Any ongoing support necessary to maintain well-being and safety should be agreed before the case is transferred back into the business as usual casework. Full guidance on the MARM framework will be available on the TSSP website following its official launch on Friday, the 17th of May.